Hi, I'm Mary Hawn. I'm chair of the Department of Surgery at Stanford, and thank you for the opportunity to talk about this really important topic in surgical training and how do we create a more inclusive environment for women and minorities in the field of surgery. I'm sorry I can't be with you live today. I had something come up and actually I think hopefully on an airplane right now. Anyway, so when I think about the why this is an important topic and why we still need to discuss it today. I reflect on this book that I read by Elaine de Botton called Status Anxiety, where he talks about kind of our social anxiousness and how we feel when we enter into a community. How do we measure up? And especially in the United States, I think we have this myth that we live in a meritocracy. And a meritocracy is a society that believes only the talented and the most meritorious will end up at the top of a social ladder. And that everybody's given an equal chance to climb that ladder and has equal ability to climb a ladder. And I think it's readily apparent to all of us that we do not live in a meritocracy and everybody doesn't come with the same chance and opportunity. So how do we as leaders help level that playing field and help give a hand up to people who haven't had all the opportunities, maybe say that some of their peers have had. So we don't live in a meritocracy. How do I know that? I'm just gonna move this around, I think, so I don't cover up my slides, because advancement is still often based on who you know. Surgery is a really small world, especially academic surgery, and we rely on our network to identify people for residency positions, for faculty positions. And so definitely in our world, advancement is still based on who you know. When we nominate people for societies or for opportunities, as we often will nominate people we know because we know they'll do a good job. And I think our biases, implicit and explicit, can blind us to competencies that are present. I know, especially as women, we often get well, she doesn't want to do this right now because she has a young family, and I wouldn't want to ask her and put that burden on her. And so I think we all have these biases, and we project on other people what we think they may be able or capable or wanting or willing to do at the time. And then I think similarly, our biases project competencies on others that don't exist. We often see ourselves in others and then may apply attributes that we either see in a colleague or in ourselves in someone when they may not really be there. So I think bottom line is we don't live in a meritocracy. So if you, and then we think about, well, how, there's a lot of work being done right now. Well, we can just use AI to, and machine learning, artificial intelligence. I mean, the computer isn't biased. Why don't we use algorithms and other mechanisms to take our implicit bias out of it? The problem is that the bias is interwoven through all of our data. So if you Google doctor and like I did here, and you go on the little cartoon images, you'll see that about 80% of the images are of a male, and in particular a white male. There are a few females and very few minority, if any, images on this webpage of Googling doctor. Similarly, if you Google nurse, you get the exact opposite. It's primarily women images that come up, and again, primarily white women. So, there definitely, I think, just using this as one way to graphically demonstrate the amount of bias that exists in our underlying large databases as well. So finally, if we Google surgeon, I actually think it looks a little better. We see many women and many probably minorities or different races represented on this slide. And this is just the top hit that comes up. So I didn't go down and compile this myself. So that makes me think maybe the field of surgery is a little more advanced, or maybe a little more explicit out there in what we think a surgeon looks like. So what can we do for each other, and particularly what can we do as leaders? And how are we going to combat and level the playing field? I think we need system solutions. So things that I think about doing is local at your own program for your medical students who are seeking to, through surgery interest groups, seeking interest in the field of surgery, that we create mentorship through surgical interest groups, that we don't have people leave before they leave because they're told by their colleagues or medicine residents or other well-meaning people that if you're a woman or you're a minority, you can't be a surgeon because of some reason. Just fill in the answer to that question, especially for women. It's like, well, you'll never get married, you'll never have children. And then I think we also need to have diverse selection and promotion committees with clear guidelines for how we select residents, what guidelines, what are the attributes that we're looking for, and then how do we amplify our candidate pool so that we make sure that we have adequate representation and even over-representation from underrepresented groups so that we can ensure that we make our field more diverse going forward. Nationally, for students getting involved in organizations like SSAT and the American College of Surgeons, other professional surgical organizations really welcome involvement of students early on. You're our future. We want to hear from you what's important to you and how we see ourselves going forward, because basically our surgical societies are membership services. People join our committees or join our societies because they want to have an affiliation with a group of professionals who have similar clinical interests, disease interests, academic interests, and be a support group and an opportunity to share ideas and come up with better solutions and how we advance our field. Similarly, in program committees, giving opportunities to students and residents to present, be able to showcase their talents and really give them an opportunity to meet with different leaders. The other thing I think that is really important to learn about is the difference between mentorship and sponsorship. A sponsor is usually somebody who you can have peer mentors, you can have people can reverse mentor. I have many junior faculty who I've received mentorship in different ways. But sponsorship is almost often somebody who has some type of positional leadership who can use their voice and influence to help lift up others. And a sponsee is somebody who's vouched for. So when your clerkship director vouches for you in a letter for a residency application, or your fellowship director vouches for you in a letter for either for a faculty position or an opportunity in a society, that gives the sponsee a leg up, because basically your sponsor is using their voice and their influence to open a door for you. And it's really incumbent on that sponsee to deliver. So if somebody is going to not stick their neck out, but use their influence to help you, it's really important that you recognize that and that you follow through. So if you, usually they'll check with you and say, hey, there's an opportunity for you to be on the program committee, or I can put your name in for this job. Are you interested? It's good to be honest, because if you're not interested and you don't show up and you don't do a good job, that hurts both the sponsor and the sponsee. So I also think a lot about responsible sponsorship. I get asked for many, to nominate people for many different opportunities. And I also observe how other people use their position as a sponsor to nominate people. And sometimes I see people just kind of, they've got like a close network, they nominate each other, they only, it's kind of, you scratch my back, I'll scratch your back, and we'll each lift each other up. That's right, that's not a common thing, but it's definitely out there. So I think in order to be a responsible sponsor, you really have to consider so many different attributes when an opportunity comes along, to think really broadly about, who are the best people for this opportunity, who are people that I'm not thinking about. So really, before just quickly responding to a request, take a few minutes to really think about people who are out there, people who you've interacted with, people who you've heard about, and see if you can have the opportunity to elevate others who might not normally have somebody looking out for them. And I think, beyond race, gender, ethnicity, orientation, we need to think about geographic representation, disciplines. Oftentimes, an organization can be overweighted or underweighted in a certain specialty within surgery. Scope of practice for many of our organizations is really important to have people who are in academic, community, rural practice. So we really understand the voice of surgery and how we represent the interests of surgeons. Types of research that people do, so that we consider all types of scholarship beyond clinical and basic research to educational research, global health research, and so on. So I think just to wrap up here, I just want to, emphasize that we don't live in a meritocracy, and believing that we do is going to just disadvantage so many, but in particular our field. And so I think it's our obligation as leaders to lift up and create opportunities for those like us and for those different than us. And finally, I think when we observe sponsorship that isn't inclusive, it's an opportunity for us to reach out, raise awareness, maybe challenge and say, can you think of a few other people, a few other names that we could put on this list before we make our final selection? So thank you very much for including me in this important panel. I look forward to watching my fellow speakers' presentations once I land. And I hope everybody has a good rest of their day.